the demand on primary care has been huge, and at our own practice alone, we've seen a rise by 41% since 2020 in terms of the demand of patients and the number of phone calls that are coming through our system. So by adopting this new model of care, it's actually not only enabled us to be able to facilitate that we can see patients on the day, no matter what the availability of appointments are, to ensure that the patient does get seen. It's also enabled us to be able to have a number of routine appointments available as well. And by having this model and having the various different clinicians that work within it, it's actually freed up several hundred appointments each month for us, to enable us to ensure that all routine appointments are seen within 10 days and that all urgent on the day appointments are seen on the same day.
So the first thing we really did was we updated our website. So we got a new website that was a massive improvement on our old one for first. We updated all the information on there, but it also allows patients to submit secure contact forms online. So for a lot of us who are digital, and as we know, the NHS is moving kind of in that direction, as is the whole world really, it allows patients that accessibility to contact the surgery however they wish, through their phone, through their computer, and they can do that day or night, knowing that someone will pick it up that working day or the next working day, and they'll get a response.
The on-call was predominantly run by GPs. So we were losing routine appointments because the only way to staff that on-call, and as the demand was getting bigger and bigger, was to have more and more doctors be able to run it. Now, a lot of the urgent on the day things, it might be a minor illness, it might be a wound, it might be somebody needs a bit of stitching or might be having heart palpitations, so they need an ECG. All of these things don't necessarily need to be done by a GP. As long as the oversight and the clinical decision making is done by a doctor who is running that hub and mentoring that hub on the day, then it's sufficient to utilize the skill sets of many other clinicians that can fulfill that.
We did feel like we were seeing everything, from the minors of ailments to mental health problems, and to complex problems all in one session. I think that did mean that as a GP, it was hard to prioritize whom to see and when to see. But with the hub model, it's given me that capacity to run my clinic the way it should be run.
The heart of everything we do is our patient care and remaining true to our rural practice.